Are essential oils safe for you and your family? Here to explain, Dr. Richard Chaffoo. Dr. Chaffoo, good morning. Always good to see you.
Good to see you, Shally.
Uh-oh, these are those oils, like your little diffusers, and you put them in your lotion.
Lotions, colognes,
What
perfumes.
happened?
Well, you know, it's interesting. There was this all started with a study back in 2007 out of the New England Journal of Medicine. It was a Denver pediatrician. He had 3 boys under the age of 10 that were using these essential oils frequently, and they had male breast tissue, or what's called gynecomastia. He found that was a common element in all of them. When they stopped that product, actually, the gynecomastia went away. So the concern was, is there some effect that these essential oils cause on the human?
Okay, but I know a lot of parents, I'm just thinking about the kids, like we use that lavender and like all those things and put them to, you know, open up their air passageway. So what would your recommendation? Would you tell people to stop using it then?
No, we don't know yet. I mean, the most recent study that just came out was presented in the Endocrinology Conference in 2018, looked at these chemicals, or about 8 chemicals in these endocrine disrupting compounds, and they found that the cells that were cancer cells, these were isolated in a laboratory course, and they found that there were changes that occurred with these cells in terms of hormone disruption. But it's a great leap going from that to saying how it affects us as humans in the natural world.
Okay, but if you are going to use them though, there is a proper way to use these oils.
Yes, there is, because certainly if you're using these chemicals in an undiluted form, they can be very irritating to the skin. So you want to obviously avoid that. If you're, the National Aromatherapy Council recommends you don't use it for very young children.
Okay.
And then if you're pregnant, obviously you want to consult your physician beforehand to make sure that it's safe.
And you don't usually supposed to put the undiluted oil. You want to dilute them before
because it's very irritating to the skin in a concentrated form.
Okay. Now that we know that, we'll have to make some changes at home. Let's talk about this male birth control. This is new.
It is new. And actually it's fascinating because there's been many issues, of course, health risk and issues with the female birth control. We found the male birth control pill has suffered in the past, Shally, because it was very high levels of testosterone that would cause renal and liver inflammation.
Okay.
The newer pill, though, is thought to be much safer, more effective, and it's thought to be something that doesn't cause any kidney damage, any damage to the liver.
So how would this work exactly? It's just like a...
It's a pill that you would take once a day.
Okay.
And it's thought to diminish the level of testosterone and 2 other hormones to the level that we're not producing sperm, so there's no likelihood for getting pregnant.
Okay, just out of curiosity, where was this study, like this research done? And then is this promising? Like, is this something that is really going to become a reality for people?
Yes, it's done in the U.S. Of course, it's FDA approved. And the next phase will roll out in April, and that will be the 3-month clinical study to determine whether or not it's effective. We've done the safety trials already, so they've shown that it's safe. Now we want to make sure that it's an effective treatment.
Oh, that'll be interesting.
Very.
Very interesting. Okay, Dr. Chaffoo, good to see you.
Good to see you too.
7:40.